brain bleeds. Bleeding between the brain tissue and skull or within the brain tissue itself can cause brain damage and be life-threatening. Some symptoms include headache, nausea and vomiting, or sudden tingling, weakness, numbness or paralysis of face, arm or leg. To most people, a brain bleed simply means any bleed inside your head. However, a doctor, and specifically doctors who treat brain bleeds, neurologists and neurosurgeons, would say that a brain bleed, also known by the medical term intracranial hemorrhage, is too broad of a term. These doctors further describe brain bleeds by their exact location. To better understand brain bleeds, it's important to have a basic understanding of the different types. First, there are two main areas where bleeding can occur. Bleeding can occur either within the skull but outside of the brain tissue, or inside the brain tissue. These areas are further divided as follows. Bleeding within the skull but outside of the brain tissue. The brain has three membrane layers, called meninges, that lay between the bony skull and the actual brain tissue. The purpose of the meninges is to cover and protect the brain. Bleeding can occur anywhere between these three membranes. The three membranes are called the dura mater, arachnoid, and pia mater. Epidural bleed, hemorrhage. This bleed happens between the skull bone and the outermost membrane layer, the dura mater. Subdural bleed, hemorrhage. This bleed happens between the dura mater and the arachnoid membrane. Subarachnoid bleed, hemorrhage. This bleed happens between the arachnoid membrane and the pia mater. Are brain bleeds fatal? Brain bleeds, regardless of location, usually happen suddenly. A brain bleed causes brain damage and yes, they can be life-threatening. The seriousness and outcome of a brain bleed depends on its cause, location inside the skull, size of the bleed, the amount of time that passes between the bleed and treatment, your age and overall health. Once brain cells die, they do not regenerate. Damage can be severe and result in physical, mental, and task-based disability. What are the causes of brain bleeds? Intracranial hemorrhage. Bleeding in the brain has a number of causes, including head trauma, caused by a fall, car accident, sports accident or other type of blow to the head. High blood pressure, which can damage the blood vessel walls and cause the blood vessel to leak or burst. Build-up of fatty deposits in the arteries. Blood clot that formed in the brain or traveled to the brain from another part of the body, which damaged the artery and caused it to leak. Ruptured cerebral aneurysm, a weak spot in a blood vessel wall that balloons out and bursts. Build-up of amyloid protein within the artery walls of the brain. A leak from abnormally formed connections between arteries and veins. Bleeding disorders or treatment with anticoagulant therapy. Brain tumor that presses on brain tissue causing bleeding. Smoking, heavy alcohol use, or use of illegal drugs such as cocaine. Conditions related to pregnancy or childbirth, including eclampsia, postpartum vasculopathy, or neonatal intraventricular hemorrhage. Conditions related to abnormal collagen formation in the blood vessel walls that can cause walls to be weak, resulting in a rupture of the vessel wall.